Despite advancements in dental technology, the incidence of periodontal disease continues to be a serious problem, and new alternatives for prevention need to be considered.
Periodontal disease is very rampant in today's society. If you look at a population, you will have more people that have some form of periodontal disease than you will that are healthy.
The American Academy of Periodontology estimates that 3 out of 4 Americans have some form of gum disease, and other studies are now confirming the link between gum disease and systemic health.
Some of the studies from our own laboratories have indicated a connection that if a patient has periodontal diseases, they are more likely to have risk of a heart attack or stroke. Now that research has been further expanded to include that of cancers, respiratory diseases, and even preterm low birth weight babies.
Gum disease is a very serious problem today, and unfortunately we've, as the profession, have been telling people to brush their teeth, and what they really should be doing is cleaning in between their teeth.
Home care is the most important thing, and flossing rates right up there at the top. The problem is we can't get most patients to floss.
The ADA reports that almost 50% of patients never floss, and only 12% do so daily.
Despite the fact that the profession, both dental and dental hygiene, has been harping on people for years to floss, people just don't floss, and they want alternatives. And if they can find alternatives that are easy to use and effective, they'll comply.
Now there's an easier and more effective alternative than string floss for your patients who don't like to floss. The Waterpik Water Flosser. Yes, a new name, the Waterpik Water Flosser. We've changed the name to Water Flosser in an effort to help your patients understand the true purpose of a Waterpik.
The name change to the Waterpik Water Flosser is fantastic because that's exactly what it's used for.
It tells exactly what the product does.
It's a flosser with water. You can't get any more basic than that.
Patients don't really realize that they can use a Waterpik instead of flossing.
We have tried for years to get people to floss, and they've heard us say, floss, are you flossing? Have you been flossing? Do you floss?
So calling it a water flosser is going to really make it easier to get patients to comply.
So now it's time to call it what it really is, the Waterpik Water Flosser. And the research is clear. The Water Flosser is an easier, proven, more effective alternative to string floss for your patients who don't like to floss.
In particular, I'm impressed with the clinical studies that show reduction of inflammation, improvement of overall periodontal health, and also reduction of various biological mediators that foster the advance of periodontal diseases.
A major study conducted at the University of Nebraska showed that the Waterpik Water Flosser, in conjunction with brushing, proved to be up to 93% more effective at reducing bleeding and up to 52% more effective at reducing inflammation compared to string floss. A similar study recently conducted at the University of Amsterdam showed that after 14 days, the water flosser was twice as effective at reducing gingival bleeding than string floss. And after 30 days, the difference was even more dramatic.
The Amsterdam study clearly indicates that the use of the water flosser dramatically reduces gingival bleeding and also improves overall periodontal health.
To better understand the water flosser's effect on plaque biofilm, a study was conducted at the University of Southern California. In this study, the Waterpik Water Flosser was shown to remove 99.9% of plaque biofilm from treated areas.
Now, we've been studying biofilms now for 40 years and dental biofilms intensively for the last 4 or 5 years, and quite clearly they're very recalcitrant biofilm, very, very difficult to remove.
Extracted teeth with heavy concentrations of plaque biofilm were subjected to a 3-second treatment with the Waterpik Water Flosser and viewed under a scanning electron microscope.
We had virtually total removal of the plaque.
Basically, anywhere that stream of water touches, it's very effective at dislodging bacterial biofilms. So there's no question that it works.
You apply the Waterpik to a plaque on a surface of a tooth, and you look with a scanning scope, and it's gone. It's simply gone. And that's unequivocal and unarguable.
And it's easy. The Waterpik Water Flosser takes only about a minute a day and will leave your patients with a clean, fresh sensation. It's a regimen that will improve improve patient compliance and make your job easier.
They love it. They want to use it. And it's not a matter of me begging them to use it. They are using it because it's easy to use.
I usually run about 50 minutes per patient. A person who uses a Waterpik, I'm usually done within 30-35 minutes.
The Waterpik Water Flosser is an excellent option for anyone who wants to improve their oral health, and it's ideal for those with special dental needs. There are 6 unique tips specifically designed for their individual needs. For your orthodontic patients, the orthodontic tip is clinically proven to be 3 times as effective at removing plaque biofilm versus string floss. For patients with periodontal pockets, the pickpocket tip can deliver antimicrobial agents deep into periodontal pockets, up to 90% of a 6mm pocket. The toothbrush tip allows patients to brush and water floss at the same time. And the tongue cleaner tip removes bacteria from the tongue and helps to eliminate bad breath. The classic jet tip is the attachment most have been using for years. It removes plaque biofilm deep between teeth and below the gum line, while massaging and stimulating the gingival tissue. And introducing the new Plaque Seeker tip, designed to give your patients the benefits of pulsating water, plus 3 thin tufts of bristles to access stubborn plaque around implants, crowns, bridges, and other areas that are susceptible to plaque accumulation. Now you can give your patients an easier and more effective alternative to floss.
We don't even ask our patients to floss anymore in our orthodontic practice. We realize that it's a losing battle all around. Ever since we started recommending the Waterpik Water Flosser, we see better results than before.
The message that I'd like to give to my fellow dental professionals is that the water flosser has been proven to be an effective adjunctive means to remove interproximal dental plaque and reduce gingival inflammation and bleeding of the gingiva.
Improved compliance, better results, and happier, healthier patients.
Look at the evidence. You can look at the research behind it. Check with your patients. Try it out. Have them use it. See how many more patients become compliant. You will be a believer also.
The Waterpik Water Flosser, the easier and more effective solution for your patients who don't like to floss.